How are you doing, Dr. Huffman?
I'm doing well, thank you.
Good, good. So tell me a little bit about yourself.
Well, I'm Dr. Alan Huffman. I am the clinic director here at the Landover office for Sport Design Rehab. I've been in healthcare for 33 years. I began my career as a medic in the Air Force. And I had 9 years as a combat medical specialist and then 6 years as a civilian EMT. And for the last 15, or nearly 15 years, I've been a chiropractor.
And what do you specialize in now?
I specialize in treatment of musculoskeletal injuries, soft tissue, people that have been injured in some type of trauma.
Often, yeah. Okay, so there's a lot of different ways that people manage the patient who's been involved in a trauma, either a car accident or they've fallen, they've been hurt at work, something along those lines. Trauma is managed different from the chronic overuse injury, is it not?
Yes.
Okay, so what are some of the best practices? What should doctors be doing when they have a patient present to them, let's say after a car accident?
After a car accident, the damage is pretty extensive. I mean, everybody's heard of whiplash, and it involves a lot of damage and injury to the spine of both most likely the cervical spine to the neck and the lower back, and many times the middle back. So what we want to do is a combination of treatments. There is a medical side where medication has to be prescribed, and there's often what's called in trauma is the golden hour. When somebody's been injured, you get them to the emergency room, and you save a lot more lives if you get them into trauma care within that 60 minutes following an injury. Now, that's not to say that every whiplash is going to be that serious, but I like to call it the golden 2 weeks. A patient that's been injured in some type of car accident or some other type of trauma really should begin conservative therapy within 1 to 2 weeks. Longer than that, and you risk the problems that come with correction of scar tissue building up, which can prolong a patient's recovery.
So what are some of the mistakes that doctors make? Just medicating first? What are some of the mistakes they make?
One of the messages that I like to get home to the physicians I deal with is when you have somebody come in who's been injured, whether it's a car accident or a sports injury, don't just have them wait a couple of weeks to see if the anti-inflammatories or the muscle relaxants are going to take away their pain. It'll help reduce it, but it won't get rid of it. We need to begin to restore function in the area that's been injured, and that's critical, absolutely critical.
So how do you do that?
When a patient comes in, we do an assessment. We want to make certain that there aren't any certain red flags like joint instability or that there's a sign of a fracture or something more serious as an internal injury. And going through the patient's examination, just as any medical physician would, helps us rule out those more serious possibilities.
Okay. So let's say someone that's ruled out and they're doing fairly well, but they're still in pain. They come to see you, you do the examination. How long does it often take to get someone better who's been involved in a car accident?
It takes several weeks. Some of the latest research done by Haas, the Haas study, talks about having a patient come in for therapy starting off at 3 times a week for 3 to 4 weeks, twice a week for 3 weeks, and once a week for 2 weeks. So we're talking about 8 to 9 weeks of therapy, and that is becoming more and more the standard of care. Often I see that there's an expectation like, just come in a couple of times a week for 2 to 3 weeks and you'll be fine. And that's inadequate.
Why? Why is it inadequate?
It's most physicians are not trained in rehab. They are not given the information that we study, that we are given. And so they're not prescribing it. They prescribe promptly and correctly with the medications that a patient needs, but when it comes to rehab, it's more frequent and for a longer period of time.
Okay, so there are some rehab providers out there that are not doing that much. There are other physical therapists and chiropractors that might see someone just 3, 4, 5 times. Are they just getting rid of pain?
Primarily, they're treating the patient symptomatically, and that is not going to be the best help for the patient in the long run. There's a loss of function when there's an injury, whether the muscles are tight and they're splinting a joint, or the patient doesn't move their neck because there's pain when they try to move it. That's what we need to correct. It's not about pain. If you restore function, you will treat the pain, which is what the patient wants. But if you get the patient better, if you make them work better, they'll feel better.
That's awesome. Well, thanks for your time, Dr. Huffman.
Thank you.
And that's all for this episode of Sport and Spine Rehab Television.